Pericardium. Please subscribe the channel for not to miss any videos. So let's begin. Pericardium is the covering of heart. Now let's think that you have a balloon and you are going to push your hand into the balloon. Now how it appears, how it occurs. Just assume that this is the balloon and this is your hand and you're trying to push it into the balloon. So the heart is trying to push into the pericardial cavity, which is like a balloon, and as it pushes, the balloon becomes like this. Now, like this. So it is trying to push or get into the balloon from one side, so that ultimately the balloon forms a cavity like this. The space between the two layers of the balloon is the cavity, that is pericardial cavity, and the balloon itself is the pericardium. A part of pericardium that you can see here. This part, inner layer of the balloon, which is close to the heart, and at one point this layer continues as the outer layer and appears here. Again, at this point it becomes the inner layer. So I said this is a part of the pericardium. Now let's see the pericardium in detail. So it is a fibroserous sac. So whatever I just said, giving an example of balloon, that is serous pericardium. So serous pericardium is deeper. Just outside that there is another pericardium, which is fibrous pericardium. So altogether it forms fibroserous pericardium. As you can see in this diagram, there is a fibrous pericardium and this is the serous pericardium. So heart is pushing into the serous pericardium. So it not only encloses the heart but also encloses the greater vessels, which can be seen here. And the location of the pericardium is in the middle mediastinum. Mediastinum is the area between two lungs, where the main content of the mediastinum is the heart. There are other structures as well. So as I said before, it consists of two parts: fibrous pericardium, which is seen outside, which is thick, made of connective tissue, and the inner one, which is like a balloon, and this is serous pericardium. And from this diagram we can understand that serous pericardium has got two layers. So this is how the pericardium looks, between the area between the two lungs. This is the mediastinum. Structures like heart and the great vessels can be seen in this area. Heart is resting on this structure called diaphragm. Let's see fibrous pericardium. So this pericardium, what you can see here is fibrous pericardium. As I said, it is tough and it is stabilizing the heart and helps to prevent it from over dilating. And it is conical in shape and made of connective tissue, fibrous connective tissue. A close view of the pericardium. Pericardium is blending with the diaphragm, thoracoabdominal diaphragm. A structure which is seen on the superficial aspect of the pericardium is the thymus. Base of the pericardium. So it is broad and it is joined, it is combined, or it is blended with the diaphragm. This part of the diaphragm is called central tendon of diaphragm, where the fibers from all the areas of the diaphragm, from where it originates, get inserted onto this area, that is central tendon. So it is blended with the diaphragm. Now the connections, how it is connected, how the pericardium is connected anteriorly. This is the sagittal section where the sternum, this is the anterior posterior part, manubrium, body of the sternum, pericardium. Pericardium is connected to the sternum by means of some ligaments. Some vessels which are arising from the heart can also be seen in this area. So there are two ligaments, superior and inferior sternum-pericardial ligament. It is connecting sternum to the pericardium. So it is sternum-pericardial ligaments. So on each side, pericardium is related to mediastinal pleura. Pleura is the covering of lung. On the medial side, the pleura which is covering the lung is called mediastinal pleura, or the pleura that is facing towards the mediastinum is the mediastinal pleura, and the mediastinal surface of the lungs, again that is the surface of the lung facing the mediastinum. Mediastinum is the space between the two lungs. Phrenic nerve can be seen here, left phrenic and right phrenic nerve. Pericardiophrentic vessels. Pericardiophrentic vessels are the branches of the internal thoracic artery, which is a branch of subclavian artery. Subclavian artery on the right side is a branch of brachiocephalic trunk. On the left side, it is a branch of arch of aorta. Arch of aorta is a continuation of ascending aorta. Now, serous pericardium. So we have seen the fibrous pericardium. Now let's talk about the serous pericardium. So we are going to talk about the balloon here, which is seen on the inner aspect of fibrous pericardium. This diagram is clearly showing the relations of the diaphragm and the fibrous pericardium. They are very close to each other. They are blending at this point. The serous pericardium is a thin double-walled membrane, and the inner aspect of it is lined by mesothelium. They are the simple squamous epithelia which are lining the inner aspect of it. So, simple squamous epithelium here, simple squamous epithelium lining here, inner aspect. Outer layer of pericardium is fused with fibrous pericardium. As I mentioned before, that the parietal layer of the serous pericardium, parietal layer, this is the parietal layer now, it is fusing with the layer or the part of pericardium which is seen outside, that is fibrous pericardium. So inner layer is very closely related to the heart, whereas outer layer there is fibrous pericardium. Inner layer is also called as the epicardium, very closely related to the heart, excepting in areas where heart has some grooves. So there are many grooves that can be seen in the heart. These are the grooves which can be seen. So there it is not closely related, because there are some structures which are running in these grooves. As we can see here, they are the blood vessels. Otherwise, the visceral layer or the epicardium is closely related to the heart. So heart, the visceral pericardium lining the heart. At this area near the root of great vessels, it is going to continue as the parietal layer. And between the parietal and the visceral, there is a gap, that is pericardial cavity. Now outer to the parietal layer, there is fibrous pericardium. So this is a space between the outer and inner layer of the serous pericardium. It contains a serous fluid which is lubricating this area, the heart, and allowing the heart to move smoothly. Heart has to contract and relax. So free movements are allowed by lubricating fluid which is produced here in the pericardium or the pericardial fluid. And there are some gaps in the pericardium. There are two gaps, the transverse sinus we call it as, and oblique sinus. Now, transverse sinus is a horizontal gap between arterial and venous end of heart tube. Now, during the development, the heart tube has got two ends, arterial end and the venous end. Later, this tube modifies in such a way that our adult heart is formed. So, it is a complicated procedure where the heart tube bends like this, the arterial end and the venous end. Ultimately, the adult heart is formed, but there is a gap that exists between arterial and the venous end. Now, this is how in adult anatomy arterial end looks and the venous end looks. So, arterial end gives rise to aorta pulmonary trunk. Venous end gives rise to superior vena cava and other structures, pulmonary veins, inferior vena cava, and so on. But there is a gap that exists. This gap that can be seen here in adult anatomy between the pulmonary trunk, aorta, and superior vena cava. So a finger can be easily passed behind pulmonary trunk, aorta, and in front of the superior vena cava. So the relation will be anteriorly ascending aorta, pulmonary trunk, posteriorly superior vena cava, inferiorly the finger is resting on the left atrium. This part is left atrium. The finger is here between aorta. This is the posterior view where the finger is this arrow, which can be seen here. In front of this arrow, pulmonary trunk, aorta. Behind that, superior vena cava, and the base here is, or the finger is resting on the left atrium. This is an anterior view. This is a posterior view. Another one is oblique sinus. Oblique sinus is a narrow gap that is behind the heart. So the heart can be seen here. The posterior thoracic wall can be seen. The heart is elevated bit to show the oblique sinus. This diagram where the heart is removed and the posterior aspect of the pericardium can be seen. The parietal layer of the serous pericardium can be seen here, and the pulmonary veins opening can be seen here. So this area is a left atrium. So here the heart has been removed to show what is happening behind the left atrium. So this area is a left atrium. So behind this area there is a gap, that is oblique sinus. Anteriorly it is related to left atrium. Of course, if the gap is behind the left atrium, anteriorly it would be left atrium. So here left atrium is placed and the pulmonary veins are opening into the left atrium. Posteriorly parietal pericardium. So this is the parietal pericardium that is seen posteriorly. Let's see the arterial supply. Arteries supplying the pericardium are internal thoracic artery. I just mentioned internal thoracic artery. This is internal thoracic artery. Musculophrenic artery. Musculophrenic arteries can be seen here. Nerves which are supplying the pericardium. Fibers in the parietal pericardium supplied by phrenic nerve. So this is phrenic nerve. This is vagus. So phrenic nerve is supplying, and it is sensitive to pain. So phrenic nerve is actually meant to supply the diaphragm, but it also supplies pericardium. Epicardium, which is the inner layer of serous pericardium, is supplied by autonomic nerves. So it is sympathetic and parasympathetic system, and it is insensitive to pain. Whereas fibrous pericardium and the parietal pericardium are sensitive to pain. Okay, thank you.